लाइव शुरू हो गया. Namaskar, friends. I am Deeptisharma Joshi on behalf of Global Healthcare MEDI Talk Show. Here in the studio, we are having with us Dr. Ravi Ranjan. Dr. Ravi Ranjan, welcome in the studio. Dr. Ravi Ranjan has left the IIT Kanpur and ISM Dhanbad to become a doctor because of his passion. And Dr. Ravi Ranjan has graduated from the RIMS Medical College from Ranchi. He has done his PG diploma in anesthesiology from Patna Medical College, and also he has bagged T.N. Jha Memorial Award for being the best PG student in his college. And he has also done DNB in critical care from Bokaro General Hospital. Sir has been the consultant of Fortis Hospital in critical care ICU, and he was a resident doctor in Apollo Hospital, Delhi, and Ram Manohar Lohia Hospital in Delhi. He has also been a consultant to Colonel Grafadi, that is the military hospital from Libya, and he is consultant and medical superintendent for Hero Honda Hospital and HWA Hospital in Delhi and NCR region. So, Dr. Ravi Ranjan is a renowned doctor for industry, and he is in the concept of building the smart ICUs. So, I would like to welcome Dr. Ravi Ranjan in the studio. Welcome, Dr. Ravi Ranjan.
Thank you, Dipti. Thank you for so many good words for me. And basically, I'm an ICU consultant and I try to be very sincere with my patients. And recently, when I realized that the lifestyle disease has taken the shape of an epidemic, particularly diabetes, blood pressure, fatty liver, early nephropathy, they have become so rampant in all over the world that they are not getting proper medical facilities. Particularly in two-tier and three-tier cities, there is, in fact, no super specialist available in our country and in many African countries where I normally visit. So I decided with my team of super specialists that why not to start smart clinics where using the e-technology we can reach the periphery and the remote areas of my country, India, and different parts of Africa. So this is an attempt to bring medical facilities to those who are needy and they are dying only because they are not getting proper medical advice in the most right time. And
Yes, doctor, I would like to understand you are also in the concept of initiating telemedicine. As in COVID, we have learned there were a lot of problems to meet the doctor, for the patient to approach the hospital. There is a lot of panic, chaos associated in COVID, and prior to COVID, telemedicine was not approved in India. But after COVID, this concept of telemedicine has initiated, and you have worked a lot in telemedicine. Can you guide us? What is the objective to launch telemedicine in India, and what is the convenience that the community is facing with
see,
telemedicine?
most important is to accept the fact that the population all over the world has gone many folds, and in that ratio we do not have super specialists and highly trained doctors. So we have to add wings, and this telemedicine platform, it is to add wings to the existing team of super specialists so that they can reach the periphery. The panic is more because there is no specialist to guide you in critical times. And in that series, we are starting a smart ICU also in remote areas where already someone is owning a nursing home. We are trying to convert some of his beds into a smart ICU where every monitoring part will be done by my team of super specialists from Delhi and Gurgaon. And you'll be happy to know that most of the consultants working in my team have experienced no less than 15 to 20 years. So our approach is to provide quality through telemedicine and affordability. We are bringing the whole system, we are providing the whole medical care at a very low and affordable price so that even the low middle class families they can also afford it.
Okay, Dr. Ravi Ranjan, you have guided us very nice about the smart ICUs and what is the purpose and objective to
Yes.
create these smart ICUs in the country, and what is the concept of the telemedicine and how you have initiated this in India. Yes, Dr. Ravi Ranjan, I just want to understand you have done a lot of work in medical tourism also for African countries. And last year you have visited African countries almost for 2 months. You have been there in different countries of Africa, Ghana, Kenya, Nairobi, and Uganda, Rwanda. You have seen Tanzania, yeah. You have seen the health infrastructure of Africa, which is really very poor, because the people are very poor, and in the remote areas, the facilities of medical diagnosis like testings, PET scan, radiology is very poor, and the examinations, blood examinations infrastructure is also very poor. And I just want to understand that how what is your purpose, and how you are thinking as a visionary, as a consultant, to develop these countries where the health infrastructure is very poor, and what type of government is helping you in building the concept over there, and what is the roadmap like to drive the medical tourism concept in Africa?
See, most important is to understand that in Pan Africa there is acute shortage of doctors, and super specialists and specialists, they are not available in the numbers which is required. So there are two ways to help the people over there who are suffering. One is to bring those patients through medical tourism to India or other parts of the world where you can provide medical facilities. But this is for a limited number of people who are rich and who can afford. Those who are suffering in masses, they cannot afford medical tourism cost. So to sort it out, we have the plans to go with e-clinics in various parts of Africa at a very affordable price. Many times it is seen that uh, their medical issues can be sorted out even on the video conference. There are anxiety, there are stress, they just need proper guidance, proper consultation, and things are done. So we are going to establish e-clinics in almost all eastern part of Africa in the first project, and it will cover Kenya, Uganda, Tanzania, Rwanda, and it will help in medical tourism in a way that uh, genuine patients will come. Like many patients, they come in panic, and after they come to hospitals in India, it is found that they do not have those kind of problems because they came running because of misdiagnosis or wrong diagnosis. So our aim is that to stop this panic, provide e-consultation. And the best part of our e-consultation is we have integrated even a stethoscope into this. Sitting in Delhi or Gurgaon, we can auscultate the patient in any part of Africa. And that is going to give a very good diagnosis. It will help in diagnosis, and we can pinpoint the problem, whether it is related to lungs or cardiac. And it's going to help medical tourism, but for those who are genuine, and it will stop unnecessary crowd.
Yeah, Doctor, great information you have conveyed about the different countries in Africa you have covered in your last year session. And again, now you are restarting this year also for medical tourism with these countries. Very nice concept. I just want to understand, as a critical care specialist, as an ICU specialist, you have given a lot of training sessions on CPR, which is one of the very important thing for safeguarding the patient once the patient has undergone some cardiology disturbances, myocardial infarction, heart attacks, or something. Then, what is CPR, and how you are training the people in the community for CPR?
Yes. Here, one thing which is very important for all of us to remember, that in sudden cardiac arrest, we do not have much time. With every single minute, we lose chances of survival by 10%.
Okay.
So in 10 minutes, the game is over. Even if you reach the patient to the biggest hospital in the world, patient cannot be saved. And in that 10 minutes, the only person who can save the patient is not a doctor, is he is the person who is sitting next to you or standing next to you, provided he knows the basic life support. Being one of the instructor from American Heart Association, I always try to coach or to give guidance for proper CPR. It is not a rocket science. It's just 1 day training, at least for basic life support. And it has been found that if the person next to you knows basic life support, 72% deaths can be saved. The only requirement is that people should know it, and people should know it in an organized way. The CPR stands for cardiopulmonary resuscitation. It is chest compression and ventilation.
Yeah, CPR is a very nice procedure that they have been given a dummy where they will be training the viewers through that dummy that how to do the CPR, that same how much pressure and thrust is to be created on the chest so that sometimes the ribs get broken.
See, important is when the cardiac arrest has many times it has been asked from me that if ribs are broken, should I continue CPR or not?
Okay.
Or I'm feeling afraid to start CPR because I think that ribs can be broken.
Yeah.
Important is the life of the patient.
Okay.
Ribs can be broken, it can be healed again, but life cannot come back.
Okay.
So do not get worried about ribs fracture. You should just learn the technique from a good instructor, and the compression should be 4 centimeter down, and it has to be, the frequency has to be between 100 and 110 per minute. In fact, I would like to conduct a live demonstration on CPR in next meeting, where we can show the correct way of doing CPR on a dummy patient. But here we can just remember that to learn basic life support, it is going to be life saving. You can save 72% of the people who are dying from cardiac arrest.
Yeah, doctor, I've seen your profile that you have been a consultant in Fortis Hospital also, and you have been a consultant in the one of the renowned hospital, Healthway Hospital in
Yes.
Rewari also, because those are both the places are different. One is the NCR and one is the prime location Fortis. Like, so I just want to understand what are the challenges of the critical care in the primitive area and in the metropolitan cities, like.
Most important is to understand the difference between working in periphery and working in metro place. In periphery, you do not have support.
Mm.
And in periphery, most of the people, they are in the hands of quacks. So if you are working in periphery as a specialist or as an ICU consultant, you are doing a bigger job, a bigger role in saving patients, because India does not live in metros. India lives in its villages where more than 90% populations are crowded. They are running to metro cities, and most of them, 90% casualties happening on the roads. So when I got the offer to work in Hway, I saw its location. It was in the periphery, and I thought, why not to work in the remote area where I can be more useful for many of the people. In metros, you can have options, but in periphery, the options are limited for the people.
So, doctor is doing a lot of work for the critical care, and critical care is very difficult aspect where anesthesiologists can understand the problem in a better way, where the patient suffering from some nephro disorder, patient having some pulmonology problems, the patient having some neurological problems. There, the important role of this critical care specialist come because they are all the time in the ICU on the head of the patient, and they have to take the very small decision. Like sometimes you are having your patients intubated, your patient is on ventilator, and sometimes you have to do the tracheostomy. So and sometimes the patient is on the coma, the patient who is shifting from outside to the ICU. It is a very challenging thing because a little mistake of any consultant or any paramedical will be a life threatening situation for the patient. So, how do you guide your staff and junior faculty, your doctors, as a challenge so that the life of those initial phases will be safeguarded? Do you train them for something?
Yes, of course. Anyone who is working in the ICU, they must be trained for basic life support and advanced cardiac life support and PALS, that is pediatric advanced life support. So without that, you cannot work in ICU. And but I give more importance to their feelings for the patients. Unless until you have your feelings that this patient is like my father or like my own relative, that changes the whole of prognosis very differently. When the patient finds uh, in you his closest relative, his recovery rates goes very high. And in ICU, I have done one analysis why young patients are coming to ICU or many those. I have always found that the real cause is stress. Stress was mismanaged. He was knowing morning walk is good. He was knowing going to gym is good. He was knowing that pranayam is, that is breathing exercise is good for health. But because he was not able to manage his stress, and finally he landed with his lifestyle disease complications, and he came to the ICU. So whenever I discharge a patient from ICU, I just do not discharge. I teach him how to keep his brain free from normal stress of the life. Unless until that is taught, he will come back again. So my focus is not to save him from the critical situation. I always feel that if the patients are taught at the same time how to keep yourself stress free, it is going to add quality to their life.
So, doctor, you have given a very good initiative about stress management, the art of thinking as a
Yes,
hobby.
my hobby is the art of thinking, and in my free times, I always conduct workshops on the art of thinking. Recently, I conducted it in Dubai also, where many, it was a number of more than 100, and everyone felt that uh, keeping oneself stress free adds a very high quality of life to this existence.
Uh, yeah, doctor, very nicely you have stated because of the sedentary lifestyle and lot of mental pressure, financial pressure, the dietary habits, and lot of pollution. Definitely, there is a lot of
Yes.
changes in the habits like obesity, CNS disorders, cardiovascular problems, oncology-related problems have put a stress on the human body, and there is a load on the heart, there is a load on the head, and there are also load on the other body parts. Yes. So what advice as a doctor, as a medico, you give to the community to have a balanced equilibrium in the stress?
Most important is to analyze those factors of stress which are under your control. You cannot decrease the pollution by yourself, but you can decrease your extra anxiety habits. You can decrease getting worried about every small things in life. You can decrease your worries about your wealth. You have to realize the biggest wealth on with you is your own health. The biggest asset for you is your own body. The biggest temple in this world is your own body. Once you realize that all those things which are around you, they are not yours. Even your body is not yours. And once you learn this, uh, you have to be content with whatever you have. Do not go into a blind race for money, fame, power. It's a never ending process. It will just end in a stress. You will neglect your health, and finally you will disappear from this world. So keep yourself stress free, anxiety free, worries free. Keep yourself happy. Even for happiness, always say it's a state of mind. Develop this habit and keep your lifestyle disease away from yourself.
So thank you so much, Dr. Ravi Ranjan, for coming in the studio, giving us such a information that you how you are to be happy, and happy is a state of mind. It is a state of living. It comes from inside. When you are happy, satisfied, contented, few things are under your control, but few things are not under your control. But it is a state of art that you have guided, yes, and you are giving a training sessions. Yes. So, can you tell your number, phone number to the viewer so that they can, having any problem, they can directly come to you?
My number is +91 98 121 93122. I will repeat it: +91 98 121 93122. Apart from ICU, I conduct workshops on stress management, and I teach basic life support free of cost. Anybody is most welcome if they be interested. And thank you, Dipti, for bringing me this opportunity to be connected with
California TV Live.
California TV Live. Thank you.
Global Medi Talk Show.
Thank you.
So, thank you so much. Thank you.